Today on Second Opinion, we're diving into one of the most critical conversations in men's health, prostate cancer. I'll break down why early screening can save lives and what you and the men in your lives need to know. Then we'll move from real life on the screen to real life in our community. An actor from Netflix Beauty and Black television series joins us to talk about portraying a character living with prostate cancer. Then an intimate conversation with a journalist who is courageously sharing his real journey with the disease. Today's show also covers the new cervical cancer screening guidelines, and we speak with a leading gastroenterologist about why gut health plays a powerful role in your overall wellness. We're tackling real health issues impacting millions of Americans. This is Second Opinion, and I'm Dr. Ebony Jade Hilton. Let's get started. Now, first up, prostate cancer. It develops in men when cells in the prostate gland grow uncontrollably. And according to the American Cancer Society, prostate cancer is projected to be the most commonly diagnosed cancer among males in 2026 and the second leading cause of cancer-related death. Now, how big of numbers are we talking? Well, about 1 in 8 men will be diagnosed with prostate cancer during their lifetime, and 1 out of 44 men will die from prostate cancer. But it doesn't have to be this way. In fact, the prostate cancer death rate declined about half from 1993 to 2022, most likely due to earlier detection and advancement in treatment. So joining me now to talk about how this epidemic is kind of moving at this stage, Dr. Paul Harvey, who practices internal medicine. Welcome, Dr. Harvey.
Good afternoon.
Yeah. So what is the recommended first step in prostate screening, and when should it start?
Well, the first step in prostate screening should be the PSA. And with Black males, it should start at 40, the age of 40. If not anything, to just get a routine number of where we are. And then thereafter, after 45, you take a prostate cancer test, which is a PSA. It's a simple test, non-painful, and we shouldn't be scared to get a PSA. And that can really save our lives, and it could decrease the disparity of African Americans and the rest of the country as far as dying, mortality, and morbidity from prostate cancer.
And when you mention PSA, what exactly is that? Is that a blood test? Is that a physical exam? What is it?
It's a blood test. Mm-hmm. It's an enzyme that we see in the prostate, and that's a marker that tells us whether or not we have prostate cancer. So there are many reasons why we should get a PSA, especially as African Americans. First of all, it's the age. We get it at a younger age, so we should take our test at 40. Number 2, it's more aggressive. And then number 3, the mortality and morbidity are much higher in African Americans. You mentioned that 1 out of every 8 people in the world, men in the world, will get prostate cancer. Well, 1 out of every 4 African Americans will get prostate cancer. And there are reasons for this. There are biologic reasons, such as genetics, which if you have a family history, a brother or a father, you're more likely to get prostate cancer, or a sister or a mother with breast cancer. That's one. And then number 2, the disparity of healthcare, access to healthcare has been a major problem with us.
And when you mention access to healthcare, where can they go to get the PSA levels drawn, right? If they say, hey, I don't have a primary care doctor, I really want to see if I have a risk for prostate cancer because my mom or my grandmom does have breast cancer, and you just mentioned that, and I didn't know they were linked. Right. How can I go and check myself?
Right. So one, if you don't have access to healthcare, which that's one thing the Affordable Care Act helped us out a lot. They provided access to healthcare for us so we can get the PSA done and we could get treatment if we have it. But if you don't, there's several places in your local area. We live in Atlanta area, so we have the Atlanta Medical Association. They have it. There have also different companies like LabCorp and Quest. They also provide at a lower fee or either free PSA screening. And then there are local fraternities and sororities around. They give health fairs throughout the year. I think Cap Apple Size having one here in the next couple months that provides free healthcare screen, free PSAs. And also there are local hospitals too that provide indigent care that can provide PSA screenings without funds or at a low cost.
No, that is incredible. And the question is, how often should they get screened? If someone says, hey, I had my PSA done 2 years ago, it was fine. I know women, we get mammograms every year. How often should there be a screening interval for prostate?
So that's a good question. So after your initial one as a Black male at 40, you can get one every 2 years thereafter. But after you're 45, we recommend getting one once a year. There are two things about the PSA, which you have. One, if it's above 4, they recommend, you be seen by a urologist. So further testing, or if that number goes up 0.75% or 1% in a year. So for example, if you get a PSA of 1 and then it goes to 2 within a year, you should be screened by a urologist. So it doesn't have to go to 4. 4 is the common number. If it goes above 4, you need to be seen by a urologist, but it doesn't have to be 4, especially in African Americans. It can go from 1 to 2, and that still means you need to be screened further, which is a urologist. We may recommend at that time an MRI or a biopsy of the prostate.
Okay. And what if you're younger than 40? You said 40 is the age that Black men in particular should really start looking at, hey, I should go and get my prostate screened.
Right.
What if I am 35, right? Are there any symptoms that would drive you to say, hey, I know you're not 40 yet, but I would advise you to go and get your prostate examined? Well,
one of the main things, the PSA, it can be helpful, but then the results can, be from other things too, such as cycling throughout the day, cycling prior to your PSA, or vigorous sexual activity prior to your PSA. That could also make your PSA go up, and prostate hypertrophy, which is swelling of the prostate. So 35 years old with no risk factors, we don't recommend that, because if you're that young and you get a PSA that's elevated, it could be from something else. And if you go down that road of obtaining biopsies and that sort of thing, sometimes you could do more harm than good. Now, if you do have a family member that had early prostate cancer, say at 45, then obtaining a PSA 10 years before that would be okay.
And what can men do to say, if they say, hey, I do have a family history, or at least the women in my family, they know their history and they've had breast cancer. What can men do to help lower their chances of developing prostate cancer, whether it's food, diet, exercising? Yeah. Is there anything that can help?
That's a very good question. Primarily, everything that's good for your heart is good for your prostate. So exercise, a healthy, well-balanced diet, Mediterranean diet helps. Vigorous exercise, 150 minutes or 90 minutes every week. Strength training, 20 minutes per week. And believe it or not, also for the women and males, intercourse also lowers your risk of prostate cancer as well.
We're out here saving lives.
Saving lives all the time.
We're saving lives all the time. Right.
That's what you guys do.
Go ahead.
I said, that's what you do, save lives.
Saving lives, And what advice would you offer to men who may be at higher risk? If they know they're at high risk and they're just afraid of the process of getting the PSA or getting the rectal exam, can you explain to them? Because I think the rectal exam is really one of the things that it prevents men from going to get checked, right? They hear about it and they think this is going to be this torturous kind of examination. Can you explain what happens? Mm-hmm.
Right, and rightfully so. I mean, if you do need a digital rectal exam, which we do in high-risk patients, it's a gloved finger, and it takes, a couple seconds to check your prostate. And I would tell them, the ones that are scared, what happens if you don't get it and you do have prostate? What's on the other side, And prostate cancer is curable. Not many of us anymore, if you detect it early, pass a prostate cancer. Mm-hmm. So, some of the take-home points of one, early recognition. So get tested early. That's the main thing. 40 years old, have a baseline, and work from there.
And what for those men, if they get a PSA and the PSA level comes back and it's elevated, and then they get a biopsy and the biopsy is negative, should they seek a second opinion? Should they repeat the biopsy? What should be done at that point?
Yes. So a lot of times you can get what we call false positives, or false negatives, meaning that they can have an elevated PSA and a negative biopsy, or and they still can have prostate cancer. So you monitor those. You take PSAs, we call observation. So you get a PSA more frequently, 3 months, 6 months, and then you can see if it's a rise in the PSA. That's other things. Other things you can rule out, things such as infection, prostatitis, that sort of thing, and sort of monitor it that way. And if you do get a PSA or a negative biopsy, MRI is also a choice. And when you do get the biopsy, you try to do a grading scale, and that can kind of tell you, called a Gleason scale. And that's kind of tells you what your risks are with positive biopsies.
With positive biopsy. You know, Dr. Harvey, representation matters. And when men see themselves in their providers, they are more likely to trust that voice and actually kind of pursue that treatment option. So can you give your social media handles or where people can find you to get advice on prostate cancer?
Oh, yeah, anytime. You can text me or at boharvey27al.com or front desk 123 at Instagram. That'll be me.
All right. Well, thank you for bringing clarity, urgency, and evidence to a conversation that can quite literally save lives. Because as you stated, if you catch it early, you do not have to die from prostate cancer. We do have treatment options for you.
Absolutely.
Thank you again, Dr. Harvey.
All right. Thank you. Bye-bye.
Coming up next, you've seen him in Netflix Beauty in Black drama series. Actor Rico Ross plays a character battling prostate cancer on the screen, but off the screen, he has an important message for all men. Stay with us.
I'm Brittany Noble, Midwest-born, HBCU educated with experience in newsrooms across the country. Well, I've teamed up with Roland Martin to bring to you The Breakdown. This isn't just news. It's our stories, our voice, our community. Join me for The Breakdown, Monday through Friday at midday, only on the Black Star Network.
Tyler Perry's Netflix series, Beauty in Black, is keeping our TV screens filled with drama and suspense. Rico Ross stars as Horace Valerie, a powerful, calculating patriarch of a cosmetic empire, but on his on-screen character is also grappling with prostate cancer. So glad to have you join us, Rico.
Hi there. How are you?
I'm doing well. Now, you are so intense in Beauty in Black. So how do you think your role is bringing this important topic of prostate cancer to the forefront of families who are watching it?
Well, I don't want to give too much away because there is a storyline that you are aware of that the audience aren't really that much aware of. So I don't want to give it away, but I will say this. I have an enlarged prostate myself. A normal prostate is about 30 millimeters. Mine is about 90. And that doesn't necessarily mean that it's a real problem. It's just my normal. And but what that does mean is that I should check it more often than others. Black men in particular, we have a stigma of not really trusting doctors and not going to the doctors, or we think that, we're going to let God take care of it. But really, I think it's something that's a simple thing if you get regular checks. But if you don't, all of a sudden you can have yourself a serious problem. And I just hope that companies like Zero Prostate Cancer can help get this information out, that it can be so easily managed if you're proactive. But if you're not, it can just flip, and it can be quite devastating for not just the individual, but for the individual's community. And a lot of us don't realize when we go, it's not just us gone. I mean, we affect everybody, our sisters, our brothers, our mothers, our cousins, our community. And so it's really important for us to, especially even earlier. I mean, normally people say, well, doctors will tell you at 50, start getting your prostate checked. For Black men, 40, I would say. And also that once Black men get it, it can be more aggressive. So we really need to be on top of it. And if you have a history of it in your family, okay, then now you really need to be on top of it.
You know, you brought up a very personal story that you yourself have an enlarged prostate. How did you know that? What symptoms were you having that drove you into the hospital to seek care in the first place?
Well, strangely enough, I don't have a lot of symptoms myself. I did a documentary called The Silent Killer on prostate cancer. And I was just asked to host it. And we went around the country. We hit 5 states and we had town hall meetings and we talked to Black men about prostate cancer. And it just learning information from that particular program made me want to go and get my prostate checked earlier. And I did, and I found out that I had an enlarged prostate. Some of the symptoms could be for me, I would have to use the bathroom more often than maybe 2 times a night or something like that, 3 times a night. And the doctor would check me, but he would say, you know, it is fine, and that it's just my normal. And that is some people's normal. But it is important for me in particular, instead of getting checked once a year, I'll get checked now every quarter. And, you know, the thing about us is that we will change our oil in our car faster than we'll go to the hospital to get our prostate checked. And I just hope that shows like yours will get the information out that it's a simple thing. It probably takes, if you're getting a digital exam, it probably takes 10 to 20 seconds to examine you. And it's such an important thing for the rest of your life.
Yeah, you know, it's one of those things about exposure. You said you were on a documentary on the film, and that's how you kind of first heard the inkling of, hey, maybe I should go get checked. How do you see the entertainment world bridging the gap into the real world health advocacy and literacy for our people?
You know, I am hopeful, because when I do talk to other celebs about it and other men about it that are in our business, they seem to be very open to it. They seem to be on top of it. I think it's not really the entertainment community, I think, that has the most problem with it. I think it's just normal folks. You know, I think we have to get the word out to normal folks that it's a simple thing that we all should do. Women are very good at talking about their health to one another. Men get together, we talk about sports, we talk about business, we talk about girls, but we don't talk about our health. And the only time we talk about our health is if we have an injury. Then we'll go deep into that if we have some type of sports injury. But other than that, we don't have those conversations. And I'm hoping that, you know, that will change. And I'm loving that in the show, there's going to be some type of exposure of the conversation. And the fact that I can go out and do interviews and talk about how art imitates life and life sometimes imitates art. I can have that conversation, and it's an icebreaker. And I think I'm going to do more of these interviews to try and educate and inform and take away the stigma behind it.
You know, and you mentioned the stigma and the lack of conversation that can sometimes be had with men when it pertains to health. And sometimes I think it's mainly because they don't know how to start the conversation, or what should I say, you know, and how to approach it. Earlier, you mentioned the Zero Prostate Cancer, this national nonprofit group that has a voice for this prostate cancer community. Can you tell the community more about what this group is and how they can become involved?
It's a nonprofit. I am a global ambassador, and what we are trying to do is we're putting on events. We're having different meetings. We're having press out. We had a fashion show in New York at the beginning of Fashion Week, where we had a bunch of celebrities, athletes, and entertainers walk the catwalk. And it was, let me tell you, it was a hell of a night, and it was a beautiful night. And people should go on social media and check out. It's called the Blue Jacket Show for prostate cancer. Blue is the color of prostate, as pink is for breast cancer. And this month in particular is our month. So I think I don't know. I think that we're starting to get the word out. Zero Prostate is such a reputable organization, nonprofit, and they're doing their thing. And I'm just so proud of it, because it's been such a silent killer for so long. That people don't even, they just take it, they accept it, that men will die of prostate cancer. And the reality is, You can, if you detect it early, you're 90%, 90+% going to be fine. But if you wait until you get into stage 4, then those numbers flip. And it's such an easy thing to take care of if you get it early. So I really recommend men and women talk to your men. And often maybe it is a woman that'll actually get the job done to get him into an exam and have himself checked. You can also have it checked with this with your blood, and that's another way of checking it. So I think things are going to change if we keep on having these conversations, these interviews. Prostate cancer and companies like that and nonprofits like that actually open the conversation. It's not a difficult conversation. And if you can use some humor, that would help too. But because it is a rectal exam, a digital rectal exam, men fear that it's going to make me a homosexual, or it's going to, all of these phobias that we have. And the truth of the matter is that what is going to make you? It's going to make you at ease, knowing that you've checked yourself and that you're fine.
Right. And when people hear, you could die, I just want the audience to be clear. 1 in every 8 men will be diagnosed with prostate cancer, and 1 in every 44 will die from prostate cancer. And we know that we can fix this, right? So how, as women, how can we help to support men to go and actively get checked, to say, hey, this is for you, but it's also for me, because I want to see you for Christmas, right? I want to see you the next year. How do we help support men in knowing that it's a scary thing to go through? That is sometimes a fearful thing of what if it comes back positive? How do we help them know that it's going to be okay?
Well, I would say this, the easiest thing, the most direct way of dealing with this, if you are in a relationship with a partner, is no sex till you get it checked. Let me tell you something. Guys will be motivated by that.
We should put that on a shirt. No sex till you get it checked.
The thing is that often we just need the impetus. And a lot of men will think, I will get around to it, but they don't get around to it. And there's no urgency to it until you've got it. And you found out that, if I had this checked 2 months ago, I wouldn't have to go through the things I have to go through now. So I would say if women who are in relationships, no sex till you get it checked, that will put the urgency that is needed for him to put it on his calendar and make it happen.
Well, ladies, you heard it here. No sex until you get it checked. Well, Rico, keep up the important work both on and off the screen. And viewers, head on over to Netflix to check out the series Beauty in Black to be both entertained and educated. Thank you again, Rico.
Thank you for having me.
From an actor who portrays a man battling cancer to a man who's living with it and sharing his personal journey. Stay with us.
Hey y'all, welcome to The Other Side of Change, only on the Black Star Network and hosted by myself, Rhea Baker, and my good sis, Jamira Burley. We are just 2 millennial women tackling everything at the intersection of politics, gender, and pop culture.
And we don't just settle for commentary. This is about solution-driven dialogue to get us to the world as it could be and not just as it is.
Watch us on the Black Star Network, so tune in to The Other Side of Change.
And joining me now is journalist Jerry McCormick, who was diagnosed with prostate cancer in September 2025 and wrote a heartfelt op-ed in the February edition of USA Today, sharing his cancer journey, stating, "I'm now a member of a fraternity that I never wanted to join." That is such a striking message. And I just thank you for sharing that, and welcome, Jerry.
Thank you for having me. I really appreciate it.
Yeah. Now, I read that you found out that you had cancer when you were supposed to be enjoying a Janet Jackson concert, right? Who happens to be your favorite artist. Can you tell us what happened and how did the news impact you?
So back in August of 2025, I noticed I went to the bathroom overnight 12 times. And I was like, well, this isn't right. So I went to my doctor. And luckily, I am blessed with a really good doctor. I recognize not everyone has that luxury. And so she said to me, well, we should probably get your prostate checked. And I said, okay. So she did the digital exam, took literally 10 seconds and said, it's a little swollen. We then had to do a MRI, then a biopsy. And I was in Las Vegas waiting to see Janet and the phone dinged. And I looked down and saw that the results had come in. So I went to the concert because nothing messes with me and Janet, okay? And then when I came back, that's when I saw that I had prostate cancer. And then being the journalist that I am, I started going down the rabbit hole, just looking, trying to learn as much as I could. And then I was in the surgeon's office a few days later and she confirmed it. And let me tell you, when you hear the C word, your mind just goes blank, and luckily I had someone with me and that person took notes because I was just sitting there in shock. Like, how could this happen? Why me? What did I do? And where am I going to go from here?
And how have you been coping? I can't imagine to hear the C word, and it's one of those things I would assume that you feel very isolated, although, again, hundreds of thousands of people get diagnosed every year, right? You are not alone. So how have you been coping going through this journey yourself?
So I've been using the skill that God gave me, which is writing. And so I've been writing Substacks. I've been writing op-eds, any platform that I can get my hands on. I've been writing because we definitely need to get the word out. This time last year, I wasn't thinking about prostate cancer. I would get it checked once a year. And now I'm going to be a cancer survivor for the rest of my life. And that's going to entail blood tests. It's going to entail probably maybe some radiation. I'm hoping against it. And so I, like I said in my piece, I joined this fraternity that I didn't want to get initiated into. And so when you are part of a Greek organization, one of the things you do is you look out for your brothers and your sisters. And so now that I'm part of the prostate cancer fraternity, I'm trying to do everything I can to help my brothers.
And talk to us through too. Once you had the diagnosis, right? We go from, hey, I'm just urinating a lot during the night and I don't know what's happening to, boom, I get a diagnosis. What was the treatment from then on? And why did you choose that treatment option?
So I had what's called a radical prostatectomy, which I had my prostate removed. And the surgeon and I had a really good talk. She explained that there were two paths, radiation or get it removed. And so for me and my lifestyle, I wanted it one and done and over with. I didn't want to go lay on the table, 5 days a week for however many weeks. I just wanted to lie down, wake up, it was over. Well, it's technically not over. It's actually just beginning because there's a chance that cancer could develop somewhere else in my body as a result of having prostate cancer. I come from a big family. I have 3 sisters and I had 6 brothers. And none of the brothers had, 5 brothers. None of the brothers had prostate cancer. And I learned in my research, 1 in 6 Black men will develop prostate cancer in their lifetime. So as I say in Hunger Games, the odds were not in my favor.
Oh, wow. Wow. And you wrote in the USA Today that the mental part was the worst. You said, my recovery has been rough. I wore a catheter for more than a week, changed my dressings daily on my wounds. My energy levels were all over the place. 1 minute I could take on the world and the next minute I can barely walk across the room. That my appetite was gone, but the mental part was the hardest. Why was the mental, when you described that physical lift, why was the mental even harder than that?
Because, and I'm only speaking for me, I felt like I was damaged in some way. I felt like my manhood had been attacked. And, who am I now? And what is normal going to look like now? And so luckily, therapy is a wonderful thing. If you haven't tried it, please do. I am seeing a therapist and she's helping me through this process. The quiet moments sneak up on you. At night, it's like, am I going to die? What's going to happen in the future? What if this comes back? What am I going to do? And then the other thing that people don't realize is prostate cancer doesn't just affect you, it affects your loved ones, your friends, your coworkers, that sort of thing. And luckily, I have received such an outpouring of love from people. And it's just reassuring that I mean so much to so many people.
I think you probably give people a lot of hope because, as you said, you are now a survivor for the rest. And I think that needs to be kind of pointed out that you have, in the process of finding this, giving yourself a chance at a very long life. You know, you wrote on your Facebook page that you want to get the message out to as many men as possible about screening. Why do you feel like now, with such a vulnerable topic, why do you feel like it's your calling to get that message out?
Because it happened to me. Mm-hmm. And if it can happen to me, it can happen to other people. And so I wear 2 daily reminders. I have these bracelets. One is a prostate cancer awareness bracelet, and it has love, strength, faith, hope. And the other one I got from Amazon, and it says, don't let the hard days win. Mm-hmm. And so I wear these as a reminder to keep fighting, and a shirt like this just to keep fighting, because this is something that can be caught. You know, you just go to your doctor, ask them for the PSA, protein-specific antigen test, then you'll find out, at least you'll know. And one of the things as journalists, we investigate. And so for me personally, if I know something, you should know something. Mm-hmm. And so that's why I'm using whatever platforms I can to tell people, hey, bro, let's go get this checked, because if you don't, you're going to be sicker down the line and wonder what happened and why, when this could have been caught earlier. So that's what I'm doing. I'm a champion that I decided to turn the C from cancer to champion of prostate cancer now, because I want us all to win.
Yeah. And that needs to be on a shirt too. Change the C. You know, it seems like the conversation is happening more now than it was 10, 15, years ago, from men in particular Black men. You know, are you encouraged when you hear stories like celebrities, Montel Jordan, who's spoken about battling this disease and how they're now cancer free? What do you think is driving this narrative for people to say, hey, I want my story to be out there for others to know about?
Because people are talking about it more. And Grey's Anatomy actually has a storyline with James Pickens. His story on the show is he has prostate cancer, and then he came out in real life to say, I have prostate cancer. Mm-hmm. And then let's not forget, President Biden also had prostate cancer, and he had treatment. And so I think the more people see that this is, it's no picnic. I'm just going to be honest. It's hard. But the thing of it is if you catch it early enough, then you'll have your life. And I know a lot of people also worry about the side effects, the incontinence, the erectile dysfunction. I had a fraternity brother tell me, because I was worried about the sex thing, to be honest. Mm-hmm. And he looked at me, he said, dead people don't have sex. Oh. And that was like, okay, then. Mm-hmm. Crisis averted, problem solved. Right. So, yeah.
Yeah. And, today, unfortunately, someone will hear that same C word, right? And they will have the same flood of emotions that you had as you got that ding at the concert and said, hey, I'm going to look at that later. What advice would you give to that person that's now sitting, staring at their screen saying, now I'm 1 in 8, like I'm that 1 in 6 Black man that has this disease? What would be your words of inspiration for them?
I would tell them that they're not alone. And it is a lonely road, traveling, because you try to explain how you're feeling, what you're doing. I'm lucky enough that I have the ability to write and express my feelings, but a lot of people don't have that ability. And so I would tell them, 1, remember that you're not alone. 2, gather your village, because you're going to need some warriors to help you fight the fight. Or, some days, like I said in my piece, I am just like full of energy. And then some days it's like, oh my God, if I can just get out of the bed, it's a win. And that's when you need your warriors to stand beside you to say, yeah, you got this. You can do this. I'm here if you want to live, if you want to talk. So I would tell that person, gather your village. And then the last piece is don't lose faith, because there are technological and scientific advances every single day. We're working to cure this thing. We're working to stop this thing. And so just keep fighting the fight, and then, always just stay on top of your health.
And how do you create your village? I know you've mentioned your fraternity brothers now several times. What if someone doesn't have that, right? How do you have even spouses or people they're in romantic relationships with, if there are side effects that are associated with this? How can we be supportive and saying, hey, I want to see you through this, and have frank conversations, either with therapy or without, that kind of work us through the process of we're both now living with the consequences of this cancer?
So you just have to be honest with your feelings, and it starts from within. There are some days where I want to be surrounded by people just so that I feel like I'm alive. And there are some days where I just want to be alone. I don't want to be bothered. You may call me and I may not pick up, and it's nothing personal. It's just, I do not have the energy to talk to you, entertain you, deal with you at that moment. Doesn't mean I don't love you. It just means I can't right now. And so to gather your village, you really have to just look at who's going to be there for you and who isn't. And I post pretty regularly, and it's been amazing to me to see how many people have said to me, hey, I can stop by with a hot meal, or, hey, if you just want to sit outside somewhere, I can sit with you. And so, I'm lucky, but at the same time, I recognize that other people aren't. And so there are support groups. I'm working to found one here in San Diego for Black men, because one of the things I did is like, well, where do I go for support? And there wasn't one. But luckily, when that same week I got my diagnosis, there was a prostate cancer walk in San Diego at a certain place. And I said, well, maybe I can go over there. And it was sponsored by Zero Prostate Cancer. And I met a few guys there. Unfortunately, none of them lived in San Diego. They lived in different parts of California. And so I virtually participate in a group, but I'm trying to have an in-person group here, because, people need to know, even though this is scary, you're not alone. And sometimes it just helps talking to other brothers about what you're going through. And one of the things I want to do once my group is formed is go to the barbershops, go to the beauty shops, go to the churches and say, hey, you got a man in your life, a Black man in your life over 40, get him to the doctor, and then if they resist you, tell them, I want you around. This is only going to take a little bit. And I think a lot of people are afraid of hearing, what if I do have cancer? Well, it doesn't have to be a death sentence if you are proactive with it.
Right. Well, thank you, Jerry, for sharing your personal story. Can you give us your social media handle? You say you post a lot and you write and you get those emotions out. There may be someone that needs to hear the words and they can't articulate themselves. So can you give us their social media handle?
Yeah, I'm at me, Jerry McCormick, on most platforms except Twitter. I've left Twitter because it's toxic. But I also write on Substacks, and it's my name, Jerry McCormick, on Substack. And I post pretty regularly, and I'm really honest with my feelings. Some days it's like, I can't do this. And then there are some days it's like, all right, this is what I learned about this today. So in a different light, caring is sharing, or sharing is caring. And so I want to share my knowledge so that I show the other people that there is someone out there that cares about you, and that you can and do have support.
Well, thank you for driving home the message that cancer can literally happen to any of us and happen at any time, and the importance of screening. We wish you the absolute best in your journey, and we are very grateful that you are a survivor of prostate cancer. Thank you.
Thank you so much. Thank you for having me.
Thank you. There's more to come on Second Opinion. Up next, we're switching gears to women and discussing the new cervical cancer guidelines. Stay with us.
Hi, I'm Dr. Jackie Hood Martin, and I have a question for you. Ever feel as if your life is teetering and the weight and pressure of the world is consistently on your shoulders? Well, let me tell you, living a balanced life isn't easy. Join me each Tuesday on Black Star Network for A Balanced Life with Dr. Jackie. We'll laugh together, cry together, pull ourselves together, and cheer each other on. So join me for new shows each Tuesday on Black Star Network, A Balanced Life with Dr. Jackie.
Now listen up, ladies. If you haven't heard by now, the American Cancer Society has announced new guidelines for cervical cancer screenings. The recommendations are that women aged 25 should start getting HPV testing every 5 years. You know, cervical cancer is the fourth most common cancer in women globally. It's caused by persistent infection from the HPV virus. Yes, a virus. So joining me now to talk about these new guidelines is Dr. Donna Adams-Pickett, a board-certified OBGYN. Thank you for joining us, Dr. Adams-Pickett.
Thank you for having me, Dr. Hilton.
Yeah, you know, the American Cancer Society and the Health Resources and Services Administration recently announced these new guidelines. And the question is why? Why is there a change now?
Well, you know, they really are basing a lot of these recommendations based on population and cost. And I'm glad that we're having the discussion because when we're talking about these guidelines, what the one line that everyone seems to miss is average risk. That these are guidelines that can be utilized for average risk individuals. Most of these guidelines involve spacing out your pap smears or even spacing out HPV testing. But that's only for average risk patients. And if you're African American living in the United States, we're not average risk for anything.
And what makes us high risk? Can you describe our subset of population?
Well, so let's talk about general high risk and then talk about how it can kind of apply to our community. So generally, we consider someone high risk if they started their sexual life, their sexual intercourse life at 16 or younger. If they've had 5 or more partners throughout their sexual life, and if they have had at least 3 abnormal pap smears in the past, and if they've ever had a sexually transmitted infection. And so any of those, just one, takes you out of the average risk category. So that's for everyone. Let's talk about our community. Many times we have not had access to healthcare. So to be able to truly determine if we have exposure to an STI, we may not have that access to determine that. To determine exactly, we don't have a lot of health education, sexual health education in our community. So a lot of times we don't realize that just having sex before the age of 16 can increase our risk. So you know, those are things that takes us out of that average risk category. Also, the HPV vaccine is not highly utilized in our community. And that in itself takes us out of that average risk category.
You brought up the HPV vaccine. You know, when people hear that cancer can be caused by a virus, they're like, wait, what?
Wait, what?
I don't smoke, I don't drink. What do you mean? And can you explain to people what HPV is? You know, because you mentioned STIs and sexually transmitted infections and herpes and warts and craps, like you can see a physical change on your body, right? What is HPV? What does it look like? Does it look like anything?
Well, first, I'm so happy you asked me this question because, you know, my other background, my other degree is a PhD in microbiology and immunology. And I actually did my postdoctoral research on human papillomavirus. So one thing that I want everyone to leave here today knowing is that HPV is what we consider common genital flora for men. It is ubiquitous in all men. So just like women have bacteria and yeast in their vaginas, and there's nothing we can do about that bacteria and yeast, every man, from my little son to my husband, every man has HPV, and no men have any control over the type of HPV that they carry. Unfortunately, HPV is in that class of viruses, the double-stranded DNA viruses that can incorporate into our genetic material, which means they never go away. If you've ever come into contact with a man, you have come into contact with HPV. You may not be able to detect it, but it is there. So typically when we're screening for HPV, we're not necessarily screening to see if you've been exposed. We're really screening to see what type of HPV you have been exposed to.
And you bring up the type. So when you see a pap smear, right, and you get your results on your My Chart, and it says, high grade, low grade, what does this mean if someone is reading their results? And when should it trigger them to be concerned that, hey, is this going to progress towards cervical cancer, or do I have cervical cancer?
So when it comes to HPV, there are about 55 types that have the potential to cause cervical cancer. There are about 11, however, that are more likely to cause cervical cancer. So when we type for HPV, we're typing for that 11 or any of that 55, but we're really targeting the big three. Those are strains 16, 18, and 45. Those three strains of HPV are responsible for roughly 70 to 80% of cervical cancers. So we are typing to see if you have been exposed to any of those types of cervical cancer, and if so, have they started to make changes to your cells? Sometimes they are just there and your cells are holding hardy. They're holding strong because your immune system has been quite effective in controlling the HPV. But sometimes your immune system isn't as strong as we would like it to be. And those HPV virions have started to change your cells. Sometimes the changes can be very mild. One of them is what we call atypical cells of undetermined significance, meaning that they're funny looking, but we don't know if they're funny looking because they're precancerous or they're just funny looking. Then there's a low grade lesion, and that is an early dysplastic cell. It has the potential to become cervical cancer, but 86% of the time your body will fix it. And then there are the more extreme cases that are high grade and cancer in situ.
The new guidelines that are put out are suggesting, because of the progression that this will lead to cervical cancer, that HPV vaccinations begin at earlier ages for young girls. So how early are we talking about vaccinating young girls, and why?
So not only have they suggested earlier vaccination, but even older, they have expanded the amount of time that is available to you to actually get the HPV vaccine. So we're talking about as early as 11 and as old as 45. And we also recommend it for boys. The reason why we're recommending it for boys is not so much to protect him, but protect his future partners. Because remember, it's common genital flora for them. So we're trying to control their viral burden. But because we know that the large majority of cervical cancers can truly be controlled just by controlling this virus, we want to potentiate the immune system as much as possible. And the earlier that we can get the immune system started working in the direction of controlling HPV, no matter what age that young lady or young man becomes involved in reproductive activities, they have a stronger immune system that can control it.
Another change is a self-collection. I saw the other day that there's this new, FDA approved self-collection kit where women can swab themselves for HPV either at home or in clinic. How effective is this method? Have you seen it where, in your own practice? And should we as women be looking to buy these for ourselves?
So it is not preferred. While it is acceptable, it is not preferred. Again, we're looking back to our community. Our community has a very complicated relationship with sexuality. So you have a lot of patients who are very uncomfortable with actually touching themselves in that area. So the concern is, are they truly going to collect the sample appropriately? So we don't want to have false negatives of patients assuming that that they have screened themselves and they're fine. I do believe self-collection has a place, particularly for those patients who have a history of abuse and who have significant discomfort seeing their doctor or their nurse practitioner. You actually have some patients that will totally avoid coming to the doctor or actually avoid having their pap smear because they have concerns about being touched in those areas. And for those patients, this would be a great alternative. But ultimately, it is preferred that collection be done by the clinician.
Wow. Dr. Adams-Pickett, thank you for grounding this conversation in evidence while addressing the real world implications for women across communities. This will undoubtedly save lives. So I thank you for coming.
My pleasure. Thank you for having me.
Thank you. Now, up next, our parents always told us you are what you eat, and they were right. Our next doctor explains that your gut is your garden. Stay with us.
Pull up a chair, take your seat. The Black Tape with me, Dr. Greg Carr, here on the Black Star Network. Every week, we'll take a deeper dive into the world we're living in. Join the conversation only on the Black Star Network.
Now, many of us remember our parents or an adult saying to us, you are what you eat. While that phrase seemed cliche when we were children, one doctor says that they were right. Joining me now is gastroenterologist and author of Your Gut, Your Garden. It's Dr. Asia McCutcheon. Thank you, Dr. Asia, for joining us.
Absolutely. It's such a pleasure to be here tonight.
Yeah. You're on a national level advocating for good gut health. Like, why is this so important for you to advocate proper food intake? And talk to us particularly about what's the brain-gut connection.
Absolutely. Let's start with the statistics, because I think the statistics really help to explain the why behind what I do. 2/3 of Americans suffer from recurrent digestive issues. Those are symptoms such as bloating, abdominal pain, nausea, changes in their bowel habits. And what's really interesting is that most people don't realize that the gut is not just responsible for digestion. Digestion does play a major role in what it's supposed to be doing. But you and I know that gut health is also connected to your brain health, to your mental health, to your immunity, where 70% of your immune system lives in your gut. And it's also connected to the risk of chronic disease. And this segment was fantastic in that we addressed, chronic disease and what that means for our community. Well, inside of your gut are trillions of microorganisms or bacteria. And those bacteria are very much like a garden, and that diversity and balance matters. And when your garden is out of whack, when it's not balanced, that leads to inflammation. And we know that in the context of the cancers that we've been talking about, 15 to 25% of cancers, for example, are thought to be related to chronic inflammation. And so that's why I wrote the book, Your Gut, Your Garden, because it really helps people understand that not only is this 30-foot tube responsible for your digestion, but there are other major roles that it's playing. And while we say, you are what you eat, that is true. But there are so many other factors that play a role here as well. And that's what I wanted to get to. What is the role of stress? What is the role of our environment on our gut health? And what is the role of previous trauma? And so we address all of that in this book.
Well, talk us through that. You said stress, trauma, and rhythms of daily life. My gut must be going through it then, right? What does stress, we all have stress in our life, right? We're juggling our roles in our families. We're going to work. We're trying to take care of our own life needs. How does that stress and that trauma of day-to-day living impact the living ecosystem that is within our gut?
This is a fantastic question. I want to start by saying that not all stress is created equal, right? We have our stress of daily living, but Black people, we have the highest, what we call allostatic load. That is the highest stress burden of any community in America. Why is that? Not only do we have food insecurities, we have, we only 8%, I believe, of our communities are census tracked for a supermarket. So access is an issue. I've seen 134% increase in inflammatory bowel disease. And we know that stress is a role. This stress not only comes from our day-to-day living, but it's the stress around us. It's the burden that we carry. It's our environment, our water quality, our substandard living, our economic disparities. All of those stressors are above and beyond some of our counterparts.
In your book, you mentioned Your Gut, Your Garden, which I feel like everyone should read. You mentioned that your gut tells your story. When you're, as a gastroenterologist, going to talk to your patients, how can you see this story being played out? What are the signs and symptoms that you can look at someone and say, hey, I know we need to reevaluate what you're doing in your life, starting from your mental health to actually what you're digesting within your body?
Yeah. I always take a step back and I give people 2 minutes when they come in, because I have so many people that walk in and they are just frustrated. The main symptom that people will complain about is bloating. It is alternating bowel habits. It's a generalized sense of a lack of well-being. And so, a lot of people are just told, hey, this is irritable bowel syndrome. And so what I make sure that I do and what I educate my peers on is, let's take a deeper dive here. What does that look like? Is it just irritable bowel syndrome? Or has this person been on repeated rounds of antibiotics? Are they working a night shift where, they don't even get a chance to recover, to rest and digest at night? They're running off of fumes. We know that increases inflammation as well. So getting a thorough history from them oftentimes will reveal that it is so much more to it than just the bloating that they're experiencing. Their system is breaking down. We see increased risk of infections. We've talked about the disparities that we're seeing within our community, and that's not a coincidence. It's boiling down to 3 factors: that's stress, food access, and environment.
And it's one of these topics too. As a gastroenterologist, we don't talk about things at the dinner table, right? When it comes down to things that you are looking for in your day-to-day work activity, right? You say you need to look back at it. When it comes to your waist, to your bowel movements, you tell your patients to look back at it. Why is it important to know what's swirling around in the toilet? And if we're not having these conversations with each other, how do we know what's normal and what's not?
That's a great question. And I want everybody to look back at it. So I'm so glad that you brought that up. The stool is essentially it should be the 6th vital sign. It is the messenger that tells us exactly what's happening inside of our body. And so we need to pay close attention to it. If your stools are nice and formed, then that's good. If your stools are clumpy and they look like milk duds, that suggests that we need more water, we need more fiber. If you're constantly having diarrhea, then that is a sign that maybe we are not consuming enough fiber. Maybe we're taking in things that we shouldn't. We didn't really talk about alcohol and some of the other lifestyle and behavioral contributors, but those may also play a major role in how your stool looks. And we know that blood in the stool can be a sign of colorectal cancer. And if you're not looking back at it, then you won't even know that there's blood in the stool. So it is extremely critical to take a look at what your stools look like. There are so many apps out here now where you can actually take a picture of the stool. You can share that with your doctor. You can track your stool. And so those are really important features that I think are great now, because it should be something that we pay close attention to.
And you mentioned alcohol and lifestyle choices, right? What are some of the things that you, as a gastroenterologist, when you're putting on that white coat, you're saying these are the three things that you need to be doing to keep your gut happy and healthy.
Yes, yes. The first thing I always tell people is diversify your plate. You should be eating at least 30 different plants per week. That contributes to a healthier gut microbiome, which is linked to decreased disease. And people kind of panic when I say 30, but it comes from fruits, vegetables, plants, whole grains. So diversity really does matter. The second recommendation that I tell everybody is community matters. Make sure you have a community. You know, we heard on this segment the power of community and how it carries us through. You know, getting back to if we have, you know, lack of access to foods, community co-ops, community gardening is important. But social isolation is something that I think contributes to loneliness and inflammation. And so I tell people, not only do you get in that community, but use that community to support each other to drive healthier lifestyles. And the third is, again, I want people to pay attention to how they feel when they're eating foods. Are they stressed? Are they rushed? Are they tired? Because if we just slow down and pay attention, take time to rest and digest, process what we're eating, that's worth its weight in gold. So those are my 3 big tips for all patients.
Look, you hit me with 30, and I just did a mental calculation, and I need to do much better than that.
Well, one salad has about 5, right?
You know, I'm challenging in my head. Like it's only, you know, we're early in the week. We have time. We have time. Thank you, Dr. Asia, for reminding us that the gut carries our history, our habits, and our healing, and that listening to it be one of the most powerful things that we can do to have our own self-care. So where can the people find you? If they are saying, hey, you hit me with a 30, I'm going to try to do that. What are some of the social media handles they can find you to get other tips on how they can get their gut healthy?
Yeah, you can find me at I am Dr. Asia on Instagram. And I am at McCutcheon Doctor on Twitter.
Perfect. But thank you for joining us. And still to come, my prescription of the week.
I'm Brittany Noble, Midwest-born, HBCU educated with experience in newsrooms across the country. I've teamed up with Roland Martin to bring to you The Breakdown. This isn't just news. It's our stories, our voice, our community. Join me for The Breakdown, Monday through Friday at midday, only on the Black Star Network.
Screening is protection, not fear. We don't like to talk about cancer, not because we don't care, but because we've been taught that looking for something means inviting it into our lives. But that's not how health works. Cancer screening isn't about expecting bad news. It's about catching things early when they're most treatable, most manageable, and most survivable. And this matters now more than ever. Over the last 2 decades, cancers are increasingly becoming diagnosed at younger ages. Colorectal cancer rates have risen sharply in adults under 50. Breast cancer diagnoses in women under 40 are increasing. Prostate cancer is showing up earlier too. And when cancers happen younger, they're often more aggressive. The reality is this: most cancers don't cause symptoms early on. You can feel fine and still have something developing quietly. By the time you feel pain, fatigue, or changes, it's often later in the disease process. Screening buys time, and time saves lives. And for our community, delayed diagnosis is a major reason outcomes are worse. Not because cancer is different, but because it's found later. When cancers are caught early, survival rates, they rise dramatically. That's not opinion, that's data. Getting screened is not weakness, it's responsibility, it's self-respect, it's love for the people who need you here. Think of screening as maintenance, not a crisis, like checking your oil before the engine light comes on, right? Ask your doctor what screenings you need based on your age, family history, and risk. And if you don't have a doctor, start with a clinic, a community health center, or a health fair. One appointment can change the trajectory of your life. Early detection isn't scary. Late detection is. Screening is not fear-based care, it's power. And protecting your future, well, that's strength. And that, my friends, is my prescription of the week. Thank you all for watching, and we'll see you next week on Second Opinion.